Welcome to your 2025 open enrollment. You have selected a medical plan with reference-based pricing. We want to educate and explain what this means for you. This means value-based payments. This system is different from PPOs, HMOs, and other types of plans you may be familiar with. It is designed to lower your medical costs. For members, it works a lot like other plans, except you can visit any provider that you'd like. For convenience, we offer a network of doctors and services. If you choose to see a non-participating doctor, there's no difference in benefits. However, be aware that a non-participating provider may choose to balance bill you. Now, how do value-based payment plans work? Better care doesn't have to be expensive care. Our health plan features reference-based pricing, also known as RBP, which is a transparent way of paying for your medical care at hospitals and other facilities. Here's how it works. To find a participating provider, you'll use the PHCS network, a robust nationwide network covering all types of providers and specialties. Now we'll come back to this. While you have the freedom to seek care from any provider, you'll minimize your out-of-pocket costs by choosing a participating provider. When you need a service that requires hospitalization, either inpatient or outpatient, the provider will call to pre-certify the service. Pre-certification confirms your provider's request for medical care meets nationally approved medical necessity guidelines. Now, how does value-based payments lower your hospital costs? With most plans, hospitals set their own prices, and some charge much more than others. With value-based payments, the plan sets the amount based on a reference determined by Medicare. Since the price is based on the hospital's actual costs, we can ensure that the price is fair to everybody. The result? Lower prices across the board, with savings passed along to you. Value-based payments provides open access to facilities with no network restrictions. When you are scheduling a service at a hospital, where you go affects what you pay. Usually, your doctor will recommend a facility for your procedure. If the facility costs are unusually expensive, Allegiant can help you find other high-rated facilities where you can receive care for less. By choosing wisely, you can keep your costs low. If you still choose to receive care from a non-participating provider or facility, you could be subject to balance billing. Now let's rehearse what you need to say when you visit a PHCS in-network provider. My plan uses the PHCS network, so I'm considered an in-network patient. I have a self-insured plan using Allegiant as the administrator. Allegiant can be reached directly at 877-293-2429. If you're scheduling an appointment with an out-of-network provider, hospital or ER, urgent care, we will say, I have a self-insured plan using Allegiant as the administrator. Allegiant will pay you and can be reached directly at 877-293-2429. If you have any questions about your medical benefits, finding care, submitting claims, or submitting a request for authorization, please reach out to Allegiant at 877-293-2429 between 7 a.m. Central Standard Time and 4 p.m. Central Standard Time. Since our plan is based on fair and transparent pricing, you should not have to worry about unexpected bills. However, as with any plan, you may occasionally receive a hospital bill above and beyond what is on your statement. This is known as balance billing. Do not pay the balance bill. Contact the Patient Advocacy Center and they will deal with the provider directly. Their phone number is 888-837-2237 and their email is pac@hsttechnology.com. This phone number, as well as the email address, can be found on page 2 and page 11 of your benefit guide. Finding a provider is as easy as scanning the QR code in your benefit guide found on page 8. You can also call 800-292-0536. Now let's review and go through this step by step. Step 1, find a participating provider by scanning the QR code in your benefit guide or calling Allegiant. Step 2, receive care from the provider. Step 3, Your medical plan covers the specified amount based on a reference price. If the provider is out of network, proceed to the last step and reach out to your patient care advocate by calling 888-837-2237. The Patient Advocacy Center, also known as PAC, is a member-driven service offered as part of our value-driven health plan services. In the rare instances of balance billing, where a provider tries to collect any amount greater than the amount the patient is responsible for, the patient advocate's role is to educate providers on the value-driven health plan services and work directly with them to achieve a resolution, all the while keeping the member apprised. HSC is a multi-plan company and has been engaged by your employer to review some healthcare medical bills and verify that all billed charges are fair for both you and the provider. For example, we identify any inflated or duplicate charges on your bill. The provider will know that an HST patient advocate is involved in your case. Allegiant will contact the provider to inform them that an HST patient advocate has been appointed as the liaison between the member and the provider. Allegiant will ask that all communications to you, the member, should be redirected to the patient advocate. Now, will your credit be affected? No. The Federal Fair Credit Reporting Act mandates that neither the provider nor the agents may threaten the patient's credit rating or report them as delinquent while the claim is being disputed. You will be notified when the dispute has been resolved.